Mark, no one is safe from COVID-19. It has now personally touched Premier Doug Ford's family. His 95-year-old mother-in-law has tested positive at a long-term care home in Etobicoke. She's one of Ontario's 634 new cases in the past 24 hours. That's a 5% increase over yesterday. Shortly before this was confirmed by the Premier's office, he became very emotional during his daily update when he talked about a photo he saw.
When I see the front page of the Toronto Sun and you see a loved one with their elderly parent and they put their hand up against the window, that's heartbreaking. You know, I relate to it in our own family, as I mentioned, with my wife Carla, or the person that got on a cherry picker. Anyways, the system, we can do better.
The Premier has said his wife Carla goes to her mother's window at her long-term care home every day. This picture in the Toronto Sun is so painfully personal. Doug Ford's mother-in-law is at West Park Long-Term Care Home in Etobicoke, which has had at least 13 deaths, with another 49 residents and 30 staff testing positive.
Look across North America and the world. It's a terrible virus. We have to do a better job. And at the end of the day, the buck stops with me. And we'll make sure we get it fixed.
It is a pain that is being repeated at long-term care home after long-term care home across the province as the death toll climbs. 516 vulnerable residents are dead. That is 72% of the province's total COVID-19 deaths. The federal government today agreed to Ontario's request for the military to come assist in the homes. The details are still being finalized. The Prime Minister, though, acknowledged it shouldn't have to be happening at all.
We shouldn't have soldiers taking care of seniors. Going forward, in the weeks and months to come, we will all have to ask tough questions about how it came to this.
Military help cannot come soon enough. Frantic relatives have been reaching out to City News, desperate for information, powerless to save their loved ones. One family says their elderly grandmother is sharing a room with a COVID-19 positive patient in an Etobicoke long-term care home, with nothing more than a curtain separating them. They have been told the home doesn't have the capacity to separate them. We are frustrated, they say, scared, helpless, adding, it is heartbreaking. As I said, details for the military being deployed into long-term care homes are still being worked out. We do know there will be 250 soldiers on their way. They will make up 5 teams and go to homes that need the most help. Sadly, there are so many of them.